Getting Back In is a reintegration program designed to help those released from prison to fit back into the community as productive, valuable members of society. They help schedule various classes such as anger management, substance abuse, and mental health. They also work with different programs in the community to provide job training. If you or someone you know needs help with resources in career development, employment, or housing, to find out more information, call 918-592-3500 or stop by 2121 North Harvard Avenue, Monday through Thursday from 9 a.m. to 2 p.m.
Hey, this is Ralph Johnson of Earth, Wind, and Fire, and whenever I'm in Tulsa, I'm tuned in to KBOD 89.9 on the FM.
Hey, it's Alfre Woodard. When I'm in Tulsa, I keep it on K-Bob. That's how I find out what's really happening. KBOB 89.9 FM.
All right, we are back. It's Dr. Price and Dr. Perdue. We are talking about, Dr. Price is talking about pelvic floor disorders. I'm mainly just listening and trying to do my Kegel exercises over here. So, Dr. Price, can we talk a little bit about what are some things that can affect pelvic floor disorders, both negatively and positively?
Things that can affect them negatively are things such as chronic constipation, or extensive heavy lifting for some of my patients who do heavy lifting just for work.
Okay.
Mail carriers, those mail trays are very heavy.
Mm-hmm.
Or if you do very heavy lifting where you're actually in, like if you work at Walmart and you're the one putting up all the inventory with those boxes. Other things that are risk factors are also smoking, in addition to obesity.
Okay.
So some of these things that are strong risk factors, you as a patient has the power to try to improve those, right? So for obesity, of course, diet and exercise, to try to help decrease how much weight is on that pelvic floor each day. As far as for smoking, to try to stop smoking or to try to at least decrease the amount of smoking that you're doing. And then as far as for chronic constipation, making sure that you have nice, soft bowel movements every other day. When you have a bowel movement, you should not have to push. You should not have to strain to have bowel movements. And if you find that you are, then that might be a sign that you are having chronic constipation.
Okay.
Other people might suffer from like hemorrhoids, which is another sign that they might suffer from chronic constipation. So 30 grams of fiber a day helps with chronic constipation, in addition to things that you might have to take, such as a laxative, just to help you get going if you feel like the fiber 30 grams a day is not enough.
Yeah. So can I understand the relationship between chronic constipation causing pelvic floor disorder, but can pelvic floor disorder cause chronic constipation?
It usually doesn't go the other way around.
Okay.
However, if you do have significant chronic constipation, sometimes stool will get trapped in the rectum that's trying to push into the vagina. And
Okay.
some women will feel like there's a pocket or it's difficult for them to empty their rectum without them doing what's called splinting, where they place their fingers either in the space between the vagina and the rectum to help get that space away so that they can empty.
Oh.
Or some women actually place their fingers inside the vagina to help them actually empty. Or what we call de-impaction, where fingers actually placed in the rectum to empty themselves because they're not
Wow.
able to.
Wow.
Other things is there's only one nerve that controls the bladder, the vagina, and the rectum. So the pelvic, that's sacral nerve pretty much runs the pelvic floor.
Okay.
And so essentially, if you suffer from chronic constipation, the body is always going to make sure that you're able to empty your bowels first, not really your bladder. So if you feel like sometimes after you have a bowel movement, then you're able to pee a little bit better, that might also be a sign for you that I suffer a little bit from chronic constipation.
Okay.
Because that nerve will make sure that your rectum empties first before they let your bladder empty.
Okay. Okay. Well, and as far as things like caffeine, I mean, everybody drinks coffee, it seems like. Is there Does caffeine help you or hurt you? If I drink 1 cup of coffee a day, should I be concerned versus drinking 6 cups of coffee a day?
Absolutely.
Okay.
I always tell my patients for something that's called overactive bladder or that gotta go, can't
Mhm.
get to the bathroom on time, to try to avoid what we call the 4 C's: carbonated drinks,
Okay.
citrusy things, and that includes spaghetti sauce,
Okay.
caffeine, which definitely is coffee, tea, which is caffeinated.
Right.
And then last, I say is chocolate because I absolutely love chocolate. So that's one of my vices that, I'm just going to have to live with. And the nice thing is when I have my chocolate, I make sure that I'm at my own house where I know where my bathrooms are and I'm not limited, but I just have to have my dark chocolate, right? So avoiding those 4 C's: carbonated things, citrusy things, caffeinated things, and chocolate. Now, if you just have to have your coffee, it's recommended 4 to 6 ounces a day.
Okay.
Nothing more than that. And believe it or not, those are not those QT cups for the coffee. They're actually 4 to 6 ounce coffee little cups.
Okay. Yeah.
But yeah.
Yeah.
And the reason why people ask, well, why does that affect my bladder? Is because of the amount of acidity in each of those things. So the acid actually irritates the lining of the bladder, and that's what contributes to that urgency and frequency.
Okay.
And if your question is, well, what would be the number one thing that I could drink and not have it affect my bladder and is very healthy for me? I know you guys are not going to like this answer, but good old plain water.
Yeah, well, you can never go wrong with water.
You can never go wrong with water.
As long as it's not water from Flint.
Yes.
Okay. But yeah. But you can never go wrong with water. So, what about emotional stress? I mean, listen, we live in a stressful world, and it seems like every year it just becomes more stressful. We as a people are under greater stressors than others are. We're not even going to go into all of the reasons why that may be, but is there a way to kind of modulate your stressors to a degree that will be beneficial in helping to lead to greater health of your pelvic floor?
Absolutely. Sometimes like the stressors that we have, sometimes we carry it in the muscles in our shoulders and then also like in our neck.
Yeah.
Believe it or not, there are also muscles in the vagina. So sometimes those muscles that are tensed up in our muscles and necks, they're also tensed up in our vagina. And so a lot of patients will suffer from pelvic pain where their muscles are tensed up in their vagina. And what we try to do, in addition to making sure that they have a good mental health provider that's helping them identify those triggers that create anxiety and also stress, is also a physical therapist that actually does pelvic physical therapy to relax those muscles in the vagina that actually control the muscles around the rectum and the bladder.
Wow.
So it's like the levator muscles are pretty much like, I call it like the bowl in the pelvis. It goes all the way from your pubic bone all the way to your rectum.
Mhm.
And so those muscles need to make sure that they're working together nicely and they're nice and relaxed. And most importantly, that they're coordinating right with each other.
Okay. And when you're doing your Kegel exercises, I would imagine that would help.
That would help
the
strengthen
and help the coordination of the muscles.
Mhm.
Okay. Because I don't know how you could separate them out, so to speak. So, okay. Well, listen, another question that will sometimes come up if, and I've actually had several aunts that have cornered me asking me some of these questions. And one of the things that they will say is that, well, I had this issue in regarding, I can't control my bladder. It is the only way that it can be managed is surgically. And really, I didn't have an answer for them other than, kind of referring them. So, are there other means other than, of course, the Kegel exercises too, and we talked about that. But are there other means other than surgery to manage some of these?
Absolutely. There's 2 major types of urinary incontinence or urinary leakage. One is called overactive bladder. That gotta go, can't make it to the bathroom in time. I have no control of my bladder. And the other is called stress urinary incontinence, where essentially the pressure inside the tummy is greater than inside the bladder. And every time you cough, laugh, or sneeze, jump on the trampoline, run after that kid that might be getting on your nerves, then unfortunately you'll leak a little bit with movement,
Okay.
right?
Mhm.
And so they are totally treated two totally different ways. For the overactive bladder, it's a muscle or a nerve reason. The reason why either the muscle is squeezing when you don't want it to, or the nerve of the bladder is not talking right to the mind, right? You're like, now is not the time to leak. Oh my goodness, I'm leaking on myself. I told myself not to do it, but it's doing it anyway. Right. It has its own mind. This bladder's not loyal, right? And so the conservative things, like we said, Kegel exercises, avoiding the 4 C's. But then if those conservative managements are not working, you can always consider medication treatment. So you've probably seen the commercials where the lady's chasing her bladder all the way around town and she's like, that's it. I'm going to go see the doctor. What that is a medication that works on that muscle pathway. So it helps relax the muscle of the bladder so that it's not squeezing when you don't want it to.
Okay.
And then there's other options too, besides medication, like advanced therapies, such as like bladder Botox, where just like if you have wrinkles on your forehead and you're like, I'm so tired of this muscle on my forehead squeezing, and that's what's causing the wrinkles.
Right.
People will put Botox there where guess what? Now you don't have any wrinkles in your forehead because that muscle is not squeezing anymore.
Right.
It works the same way for the bladder. You can put bladder Botox in the bladder and that helps the bladder muscle not squeeze as strongly. So you don't have leakage.
So you don't, but you don't lose the ability, because
you don't lose the ability.
Because I can see you going all the way in the other direction if
Yeah.
if you're too aggressively treated. Okay.
Yeah.
Okay.
But that's an option, and it's just 1 to 2 injections a year in the clinic. So where you don't have to take a medication, it's just a doctor visit, and then you leave and you see them maybe another time that year, or you see them in a whole another year. Other options are acupuncture, where essentially there's a nerve that's right by the ankle. That it's the same nerve that controls the bladder. So you can do acupuncture once a week for about 12 weeks. And then afterwards do what we call maintenance therapy, where you come in once every 6 weeks, just as like a tune-up. That actually works on the nerve pathway. So we talked about how the medication works on the muscle pathway, and then the acupuncture works on the nerve pathway.
Wow.
So there's plenty of options. Some people decide they want to work on the nerve and the muscle pathway. There's no right or wrong answer, but those are things that avoid surgery.
Okay. And in regards to the bladder Botox, I would imagine that would be an individual that would need to come to you specifically, or someone specifically of your skill set. I wouldn't necessarily go to a medical spa for something like that.
Yes, they are not trained to actually do bladder Botox.
Yeah.
So I would recommend probably to find a urogynecologist or a female urologist that's trained in performing that.
Okay. All right. Well, listen, that's fantastic information right there. So, I'll have to tell my aunties that, look, you know what, there may be some other obstacles. Not that I'm going to try to explain it to them. I'll have to end up sending them in your direction. So another common question is pelvic floor disorder a natural part of aging? Natural from the standpoint that everybody would get it. What would you say to that? Is that a true or a false?
That's actually false. It's
Okay.
not a normal part of aging.
Okay.
And essentially, there's so many opportunities that we can do to try to help you regain that control back over your life and get back to the quality of life that you want to live.
Okay.
So don't feel like there's no help and that's just how it's supposed to be, because there actually are resources that we can provide so you don't have to have that issue.
Okay. Well, that's always helpful. So, I think we know this one. Having children increases the risk of suffering from pelvic floor disorder. Yes.
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 Yeah.
And I guess the more children, the more stress, right?
Yeah.
On the pelvic floor.
But still have those kids,
Yeah.
because the kids, they're just so wonderful.
Well, listen, they truly are. Unless you're chasing them around and your bladder's in a completely different place than it
Yes.
was prior to your child getting there. But in regards to your specific practice, is your practice one where you are just almost inundated, like you almost need to clone yourself so that you can actually see everyone, or is this relatively an uncommon type of thing?
No, unfortunately, there's only 1,200 urogynecologists in
Wow.
the United States.
Wow.
And for some people that don't know, well, what does that mean? 1,200? That sounds like a big number.
Yeah.
It is actually not. For a primary care provider, if you think about it, there's 1,200 alone in the state of Oklahoma for a primary care provider. So for the whole nation to only have 1,200, which means that unfortunately patients might have to travel to see a subspecialist because it is a subspecialty. But the nice thing is we do have in obstetrics and gynecology, we do train them in components of basic urogynecology of how to take care of patients who might have not as bad pelvic organ prolapse, where we have stages from 0 to 4. Stage 0 is normal. You're like 16-year-old, everything's where it's supposed to be. And then stage 2 is when it's right there at the entrance of the opening of the vagina. And stage 3 and 4 is when it's outside.
Okay.
And so for anyone that's above a stage 2, I'd probably recommend to send to a urogynecologist. But those who are not as severe, then an OB-GYN can actually help you with that because there's not that many urogyns to actually go around. In the state of Oklahoma, in Tulsa alone, there's only 4 of us. So myself, my partner, Dr. Gold at OU, and then we have a female urologist, Dr. Melanie Kajanji at Utica Park, and then also Dr. Sunshine Murray. As far as for female providers that help with pelvic floor disorders. Okay. So those are resources like who could be around. But yeah, we are extremely very busy. Yeah. And unfortunately, as our population gets older and older, it keeps us staying very busy.
Yeah.
Because that's one of the risk factors is aging. So
do you find that you have more people of color in your practice? And there's always the concern of a lack of access or lack of knowledge, which is kind of the birthplace of this radio show, is the fact that just trying to pour into our community so that that, hey, this does not have to be the rest of your life. There are questions that you can ask. There are avenues for you to travel in. So I guess the first part of that is this a condition that we tend to see more in the community of people of color?
As far as for pelvic organ prolapse, we do tend to see it more in Caucasian women. As far as for urinary incontinence, so leakage, we see that more in women of color.
Okay.
And there's a million and one reasons for that. It might be for access of care. We have noticed that when you look at the data that the majority of the surgeries that are performed on patients who have pelvic organ prolapse, it is predominantly Caucasian women. And so the question is it just because African-American women or other women of color just don't have access to a urogynecologist? Yeah. That one, no one can really answer because we don't know.
Right.
I do notice that I have more patients when we go to our outlining community clinics, such as Bedlam Clinic. I tend to have more patients of color at Bedlam Clinic versus in my clinic at in Midtown.
Okay.
But it might be just the fact of where it's located. I don't know.
Yeah. Well, listen, I think this is a great opportunity for us to take another break. Maybe we get another phone call or two in. For our audience, our number is 918 area code 856-3873. Let me say that again, 918-856-3873. You are here with Dr. Perdue and Dr. Price. So give us a call.
This is KBOB 89.9 FM, Tulsa. And now streaming 24/7 live from the Eden Media Studio. 24/7 live at KBOB899.com.
How to order chicken wings. Number 1, find a good wing spot.
I know a wing spot, Max Wings.
Number 2, decide if you want a combo or if you want to order a la carte.
Huh? What's that?
Well, combos come with chicken, veggie sticks, fries, and a drink for a discounted price. A la carte means that you order each item separately.
Ah, okay.
3, decide if you want bone-in, boneless, or cauliflower wings, and then determine the delicious flavor you want on your wings.
I didn't even know cauliflower had wings.
You learn something new every day. Have you been to Max Wings?
Yep.
Max Wings is located at 782 East Pine Street in Tulsa. We're open Monday through Thursday from 11 a.m. to 8 p.m. and on Friday and Saturday from 11 a.m. to 10 p.m. Come to Max Wings, home of the dry rub fries.
We're your growing peoples, and we love that funk they play on KBOB 89.9 FM. Don't you stop it. Don't you stop music.
Hey family, how we doing? Once again, this is Dr. Perdue and Dr. Price, and we've been talking about pelvic floor disorders. She is a urogynecologist, and she is one of 1,200 in the country. You know, I thought as an interventional neurologist, which is what I am, that we had a limited number. I think that there may be a fewer number of you than it may be of actually us. So, again, that kind of lets you know the people that you have representing you in medicine are absolutely amazing. And, we need to all take a great deal of pride in that. There have been some amazing physicians that have come through this radio show, and individuals that we're going to actually see or get a chance to talk to in 24. So, we are trying to pour into our community so that you guys have the information you need to make the best decisions you can for not only you, but for our community as well. So I want to get back to Dr. Price and talk a little bit more about pelvic floor disorders. And, again, I feel very green in this area because, as a man, it's not something that we typically see. We typically hear about it. Maybe we hear about it from our wives or spouses or mothers or other individuals because, I think that there sometimes is a sense of embarrassment or have I done something per se that has caused this? And it's not a matter of that, having children, that's what we are here for, to procreate. So, I would love to just kind of hear some kind of words of wisdom that you impart upon some of your patients in regards to this, where they may come in with a feeling of guilt or a feeling of sadness over the decisions that they've made. And some of those are some of the most beautiful decisions that you could possibly make.
Mm-hmm. Absolutely.
Yeah. I think we have a caller.
Hello?
Hello. Hi. How are you? Thank you for calling in.
Hello, I can't hear you.
Can you hear me now? Hello?
Oh, I can't hear you. Oh.
Okay. You want to try to call back?
No, I can't. I can't hear you.
Okay. All right. Well, listen, we're going to have you just try to call back. So we'll disconnect. Why don't you try to call us again?
Oh.
Let's go ahead and disconnect.
Hello?
Hello?
Can you hear us now? Hello?
Hello?
Okay. Let's go ahead and disconnect. Well, we are sorry about that. Again, please call or try to call us again. Maybe, is this a glitch in the line?
Oh, you can hear us now.
You can hear us now. Okay. All right. What's your question?
Hi. So I've been doing Kegels for the whole show. And I'm wondering, what if you're not experiencing any symptoms? And how do I know it's working? It's very tiring, these Kegel muscle exercises. And will it get easier? And that's how I know that, how when you work out a muscle and that exercise over time, you're not as tired doing it because those muscles are getting stronger. Will that be the same for my Kegels? Will it be easier later and I'll know that the muscle's getting stronger because it will be easier?
Perfect. Well, the first thing, the question about how will you know if it's working? So I usually tell patients, when you're peeing, if you can Kegel and stop yourself mid-pee, then you have some strong Kegels. Now, I don't want you to do it every day because you're going to develop a voiding disorder. I want you to be able to, like, when you pee, nice pee, and not focus too much on how strong your Kegels are. But every like once or so, a week, if you just want to say, I want to see how strong my Kegels are. Am I able to stop myself from peeing? And if you can, by doing a Kegel exercise, then you are doing amazing. Now, another thing is sometimes people want those biofeedback of using Kegel balls. And you can go on any local, even they sell them at Walmart, but essentially they come in little marbles that graduate from a little like less than a third of an ounce, and it gets heavier and heavier with each size of the Kegel balls. And some women actually will insert one inside the vagina and see if they can actually keep it in the vagina with the squeezing of their Kegel muscles. So that's another way if you want to be very aggressive and see how strong your muscle is, if you're looking for the strength of your muscle versus stopping yourself in mid-pee, is to see how functional that your Kegel exercises are. So if you want to do both ways, you can always do that to see how strong it is and then also how functional it is. But those are some options. Yes, as you do Kegel exercises more consistent, you'll notice that it's easier to do. It's more they'll feel stronger, but most importantly, you'll just feel good about yourself that you're doing something to help prevent a pelvic floor disorder. So just the knowledge that you're empowering yourself to do something and you didn't even have to leave your bed to do it, right? That's something rare that we actually have the power to do with no one helping us but just us.
Okay.
Awesome.
Thank you.
Thank you so much for your call.
All right. Thank you for calling in.
Thank you so much for the information. That helps. Okay.
Bye.
All right. Have a good
Bye.
day. Take care. Bye. All right. Well, doing Kegel exercises for the last 30 minutes. I know she should be pretty tired from that, but you know what? You gotta love the passion behind it. So, we talked a little bit about kind of the population of patients that you see, and other than imparting knowledge in regards to different exercises and different techniques that can be used, as well as surgeries that can be used, is there any other kind of knowledge that you kind of impart upon your patients in regards to, I can imagine being in a situation where you have an accident in public and how incredibly embarrassing that is, when really it has nothing really to do with you. It's just a part of your anatomy and where you are in life. And so what do you kind of say to some of your patients in regards to things like that?
So the number one thing that I tell patients, especially when they come and see me and they're like, something's just wrong with my body. I can't really explain it too well, but it's just not how it used to be. Right. And I let them know that unfortunately the number one risk factor is aging, and no one can stop the clock. It is nothing that you did. It's nothing that you can try to prevent, but you can empower yourself to help improve it and make sure that it doesn't get worse. And I think just having that knowledge that you can actually help yourself to prevent from worsening of a pelvic floor disorder is half of the battle.
Yeah.
The other thing that I tell patients is be an advocate for yourself. You'd be surprised of just asking a question or two when you're actually seeing your provider will actually set a conversation or a dialogue for them to know that you're also a partner in your own health, and that it's not a dictatorship, it's a partnership.
Absolutely.
So I think the number one thing is knowing that for pelvic floor disorders, unfortunately, the number one risk factor is aging, and no one can stop the clock. The other one is, like I just mentioned, being a health advocate for yourself. And if you are the caregiver of a mother or a father, to be a health advocate for them too. Yeah. Navigating the healthcare system is extremely hard, but having a team actually coming to that appointment to let them know that it's not just them that's going to be affected by this recommendation that's coming from your physician, but it's going to be the whole family. Right. So definitely be an advocate for yourself and an advocate for others. I recommend for every female patient to say, go have mammogram parties. You know, when you have a mammogram, it's hard for you to remember it, schedule it when it's your birthday.
Yeah.
That's your birthday gift for yourself to make sure that you're not going to be a statistic for African American women who have a higher rate of breast cancer being found at a later stage.
Yeah.
So every time when it's time for your birthday party, do a little mammogram in that morning, help you feel good about yourself.
Amen.
The other thing is, and then encourage your other sisters or your mom to come with you.
Yeah.
Right? Take a friend. But those are the big 3 things I would say is, be a health advocate for yourself and for others. And most importantly, make sure that you educate yourself about everything. Be aware a little bit about Dr. Google, because unfortunately, Dr. Google will have advice on there that it's not really good advice.
Mm-hmm.
But the ones that you can find on Google are the medical societies that has actually been through the rigor and all of the hoops to make sure that what they put out, every physician in that community agrees to it. Because it not only represents just that provider, but it represents their community. And so for pelvic floor disorders, we actually have a pelvic floor disorder voices.org. So pfdvoices.org, which actually has all this information that I just shared with you, in addition to like a little pop quiz that you can actually take to make sure that, do I have one or not? Because sometimes you just don't know what you don't know.
Right.
But if you are going to go to Dr. Google, I recommend trying to make sure you look at the medical societies that each of the specialties represent. And that'll give you the information, because there's always patient information section on those sites that gives so much information about that specialty in itself. And it helps you sometimes if you're just a little worried about, well, if I go see this specialist, what questions should I ask? Because I don't know. And it gives you the tools to ask what questions you should be asking if you don't know what you should be asking.
Right. Well, listen, this has been a fantastic hour. It's refreshing when we as experts in our own field can learn something new. And I greatly appreciate you being here, Dr. Price. You are, your resume and your CV is impeccable, and you know what? It gives me great joy and pride to sit across from you and to hear all the wonderful things that you're doing and all the medical knowledge that you're imparting on to our community. So this is the what our community, our health radio show is all about. It's about, sometimes talking about issues that are a little uncomfortable, but things that need to be said so that our community can be better educated in regards to how we can manage our own affairs. So, once again, we want to thank our audience for tuning in. Thank you for those phone calls. 2024 is going to be a year of incredible knowledge and incredible. We have so many desires in reaching out into our community, and we want to hear from you. This is your radio show. If there are topics specifically that you want to hear about, we will make it happen. There's enough experts that we have in a variety of different areas that there's no topic that we cannot cover. So again, you guys have a blessed day from Dr. Price and myself, and we look forward to talking to you next week. Remember, our community, our health, 12 to 1, Friday afternoons.
This is KBOB 89.9 FM, Tulsa. And now streaming 24/7 live from the Eden Media Studio. 24/7 live at KBOB899.com. 36th Street North Event Center and KBOB 89.9 FM presents the All-White Holiday Affair. The All-White Holiday Affair starring the Eden Out Band live. Yes, it's Bobby Eden and his band bringing the vibe to 36th Street North Event Center. And just when you thought it couldn't get any better, we got a special guest host and live performance from Team Rush. Hold up.
Wait a minute.
Hold up.
Get it how you live it.
Wait a minute. You mean I get the Eden Out Band
10 toes in
and T-Rush live on the same stage in the same night
when we standing there on business?
You know this, man. Enough said. I'll see you at the 36th Street North Event Center, 1125 East 36th Street North, Saturday night, December 28th. Doors open at 7 p.m. and the show starts at 8 with DJ JB Smooth on the ones and twos. Get your birthday table, ultra VIP table, reserve seat, and general admission tickets right now. Online at allwhitetulsa.eventbrite.com or Ralph's Menswear, the KBOB Studios, Styles of New York, Starship Music, and Fashion Fever. All white attire is preferred, but not required, because the grown folks is stepping out with the Eating Out Band Live. See you there.